This is the third part of learning and memory. So in the last slide presentation, it ended with the Australian man who was talking about his own experience with temporary hippocampal damage. And I'm going to shorten a lot of this as much as I can, and it's not going to seem that way because when I'm going to ask what's the hippocampus doing for us, it's doing a great deal. A lot of what we know of what the hippocampus is doing for us is from the patient HM. And if you've had any kind of background in memory, if you've taken any class where they've talked about memory, they've probably talked about HM. He is a patient, or was a patient, who had not just his hippocampi, so on both sides, removed, but some of the nearby structures of the medial temporal lobes were also removed. And the pictures at the very bottom are showing various slices that show the area of his brain that is missing now, or that was taken out. And he's probably more famous than most of the memory researchers, as they did a great deal of research on him. You can consider him one of probably the best known case studies in the history of memory, as he lived with this hippocampal damage for decades, and so we could see the long-term effects of damage to the hippocampus. What we saw as the symptomology in HM is what we see with hippocampal damage in general. So he had impaired long-term memory, but his short-term memory, working memory, remained intact. And I used this example last time of him remembering the number 584 for 15 minutes as he went through this strategy and kept it in his short-term memory, explained the strategy, remembered the number, and then as soon as someone distracted him, forgot the number, forgot the strategy, forgot everything. Is that as long as he was keeping something, rehearsing something, and keeping it in short-term memory, he was fine. He had a few weak semantic memories. Really, semantic memories are built up over episodic memories to a great degree, but he had some weak semantic memories from information that was encountered more recently, or information that was encountered after the surgery. So people who had come around after his surgery in the, I want to say it was in the late 50s, if he was given Elvis or the name Martin Luther as first names, he would say Presley for Elvis and King for Martin Luther as last names, which suggests that he had some semantic memory. I do want to say that to some extent, that finishing, hearing Elvis and saying Presley has some amount of implicit memory to it, but it's showing a semantic memory. He had severe impairment of his episodic memory, so he can describe facts from before the surgery, but is not good with personal memories. So with the anterograde amnesia, he was not laying down any new episodic memories, and he could see the same doctors and researchers and do the same tasks and not remember ever having that autobiographical experience. And if you remember what the Australian man said, and so part of what we're going to see with the hippocampal damage is some graded retrograde amnesia as well. And so if we look from before the surgery, he had facts from before, he had what he had learned from before the surgery, but was not so good with the personal memories from before the surgery, and especially as you get closer to the surgery. He had better implicit memory than explicit memory, so he was still able to be conditioned. There's an example of him sitting in a particular chair and having the puff of air to the eye, the aversive eye blink conditioning, and he would immediately react as if he was conditioned. They would have him sit down in the chair to do the task. He would have no idea what he was doing there. He would have no memory of doing that task, but he was classically conditioned nonetheless, as the amygdala and the cerebellum were still working, and he had intact procedural memory. So he was able to, one of the tasks they use sometimes for this is the mirror drawing task, where you look at a picture and it's in a mirror, and you're tracing the picture from looking in the mirror. And if you ever just go ahead and try and do something in a mirror a little bit, at first it's really hard because everything's opposite, goes the opposite way of what you expect, but it gets easier and easier. And again, doesn't remember doing the task before, but sits down and does it surprisingly well for himself because he doesn't remember doing it before, but that procedural memory is intact. And in fact, if I remember correctly, he got some kind of not a factory job, but maybe a factory job. It was where you're doing the same task over and over again repeatedly in his job, and that he was able to learn because it was procedural memory. I repeat here what I've just said really, but this is the nice kind of summarized synthesis from the book of people with this type of amnesia or hippocampal damage show this pattern, which you can read. So if we look at the theories of the function of the hippocampus, this hippocampus is helping us with all of these things, but the first one is that the hippocampus is necessary for declarative memory, especially episodic memory. And they've looked at this by looking at non-humans doing these either a delayed matching to sample task or the delayed non-matching to sample task, where the monkey in this case is given the sample. We're going to show a delayed non-matching to sample task, and the sample in this case is the triangle, and so that's the object they need to remember. And then they also need to remember that this is, as they're learning the task, that this is a non-matching to sample task. They have to remember that this is the task that they are performing in this case. And so in this case, they're going to go look for the food under the new object, and the monkey's going to know that the food is under the circle because it's not matching the triangle. And with hippocampal damage, we see that this is a very difficult task for animals to do. We also see this with prefrontal cortex damage, as there is some working memory in this, but there's declarative episodic memory in this as well, as I'm remembering both my task and what the sample was. The hippocampus is necessary for spatial memory. I got this a lot on the first exam of just it helps us with navigation. And my example before was the research done with London taxi drivers. So remember, they need to know London well enough to be able to answer questions like, how do you get from tourist area A to tourist area B, regardless of what those are in this huge city. And then they also take this simulated driving task test where they are shown that certain routes have construction and they have to find a different way around. They have to really know London. And we see that London taxi drivers have larger parahippocampal place areas, so this area around the hippocampus, than non-taxi drivers, and then larger hippocampi, larger areas than London bus drivers, as taxi drivers are constantly learning the navigation of this very large and busy and changing city. And the longer they're taxi drivers, the larger that parahippocampal place area. We also see they've looked at rats in these radial mazes where if we have something like, let's say some of these floorings are have a light down them or have carpet on them. I'll use carpet. Have carpet on them. The rats with hippocampal damage can learn that as if they have food under just some of the radia off of there, if they have food in some of those and food is never on the carpeting, the rats will learn to avoid the carpeting, but the rats do not learn to avoid looking in places where they've already looked. So if they've already looked and they've gotten food, or there is no food, they don't need to look back down that radial, that part of that arm of the maze. And yet they'll keep looking down the same arms of the maze that they've looked down before because they're not creating that memory for their spatial orientation. The final theory of the function to the hippocampus, and I'm saying the hippocampus really helps us to do all of these things, is how these theories came along, and how they fit together is really the question. So the hippocampus helps us to remember the details of context. If we think back to those older memories, remembering those memories, bringing those up, like me talking about my 5th grade birthday party, that involves the hippocampus less than me talking about something that happened a couple of weeks ago. As we get into the older learning, or things that are older and back farther in our past, they really have less context. So the more consolidated a memory becomes, the less it depends on the hippocampus. Okay, I'm going to repeat some of what I have said now a couple of times about the basal ganglia and procedural learning, but I do repeat it a few times in classes because there are still people who are saying, when they're talking about the basal ganglia, and because we talked about them, especially because we talked about them as those movement structures, the caudate and the putamen, so specifically the striatum, that part of the basal ganglia, that they are indeed involved in muscle memory as we think of it. That is because that kind of, when I'm typing or when I'm riding a bike, that is a kind of procedural learning. But other procedural learning is more cognitive. We start to notice patterns. We start to notice patterns in nature, in the games we play, and it's this, we start to notice the pattern after we have built up a great deal of experience. It is gradual, and a lot of the times we can't tell somebody else the pattern or the rule that we are now following. When we're doing that kind of learning, we are using the basal ganglia. So I have this task being shown here, which is slightly different from the one in your book, which I suggest you go look at, especially if this is all, if this feels at all like it doesn't, you're not putting it together with what I'm saying. But so this is the weather task, and you would get hundreds of these basically, and these, I'm showing here a light bulb, a butterfly, and a boat, but there would be more pictures. And let's just say, so I'm trying to predict the weather, whether it's going to rain, let's say be cloudy, or have sunshine. And so let's just say that the light bulb usually tells me it's sunshine. Well, at first I'll be going by that rule. Oh, I see the light bulb, it's going to be sunshine. But let's just say when there's a butterfly and a boat at the same time, it's likely to be cloudy, or it's likely to rain. Let's do rain since it's a boat. As I start to learn that piece of the rule, so the boat means, maybe the boat means cloudy and the butterfly is nothing on its own, doesn't tell me anything. I'll say, well, it's the light bulb and the boat. Is it going to be cloudy or rainy? But actually, there'll be the boat and the butterfly together really trump things and say it's gonna rain. And eventually, we'll start to learn all of those complicated, that set of rules, and we'll be able to predict the weather. So we start out at something like 67, 64%, because we're just following some basic, what it appears like the rule is at first. But then as we do this, 100 of times or more, we start to really get that rule. We get up to something like 90-something%. And so if I have damage to my striatum, that's the kind of learning that I'm no longer going to be able to do. Not only not being able to learn how. So if I've already learned how to type, I'm okay. If I've already learned how to play the piano or whatever, but I'm not going to learn new things so well. And this kind of rule learning also, I'm not going to learn so well. Nope, so I just said this on the previous slide, but I'm going to go through it with words and more officially. People with Huntington's and Parkinson's disease, they perform like normals at first, at the 64%, but they don't get up towards that 100% accuracy. The gradual learning is what's impaired. So they have trouble learning new skills, especially motor skills. They can remember new facts. Callatt discusses two other types of amnesia, Korsakoff syndrome and Alzheimer's disease. I'm going to start by talking about Korsakoff syndrome. In this disorder, the people lack thiamine for an extended amount of time, so neurons can't metabolize glucose properly. If you go way, way back to the nutrients of neurons and how neurons work, if you remember, they're utilizing glucose and oxygen, but in order to metabolize that glucose, they need thiamine or B1. What happens is This Korsakoff syndrome occurs when people are pretty much chronic hardcore alcoholics. These are people who are drinking hard alcohol a great deal of their life in order to get Korsakoff syndrome. It's not something that happens because of some alcohol use, but over time, your author says that it is because their diet is basically made up of alcoholic drinks, but that's not the whole truth, as what happens is when you are drinking alcohol, you are not really taking so many nutrients into your body. It closes the villi of the intestines, and it particularly leaches off vitamin B1. So you are not metabolizing thiamine at all when you are drinking alcohol really chronically and pretty hardcore. The first areas, or the area that's most affected, is the dorsomedial thalamus, and this is a main source of input to the prefrontal cortex. And so some of the impairments of Korsakoff syndrome look kind of similar to people who have damage to the prefrontal cortex, because these are the connections, a main source of connections to the prefrontal cortex. So we see some apathy, some confusion, and some memory loss, as there's often confusion when we're losing a lot of our working memory. But what we're really seeing is that kind of not laying down new memories well either. And another aspect to this disorder is that they confabulate. Okay, so they will make up what they remember to be true, if you will. And they are not confabulating weird and wild stories. Usually what they're doing is remembering something that happened at some point in their lives and saying, yes, I did that last weekend, because they don't really remember what they did last weekend. I always thought that maybe this confabulation came from a strategy of when we do black out when we're drunk, that we other people are telling us stories and we kind of fill in those memories, and so we're starting to make up memories. But this kind of confabulation occurs with several different kinds of disorders, not just Korsakoff syndrome, and it appears to be something specific about the brain regions that are damaged here. Okay, and so Alzheimer's disease, like Korsakoff syndrome, so I didn't say this with Korsakoff syndrome, but I'm going to say it now, they have better procedural memory than declarative memory. If we go back and look at the brain structures that are involved, the basal ganglia appear to be fine in these people, and they're able to learn the weather task, whereas we see Huntington's and Parkinson's disease patients, while we don't think of those as being memory disorders, that their procedural memory is what's impaired. So in these disorders, they have better procedural memory, worse declarative explicit memory. For Alzheimer's disease, it really, early on, it starts out with a great deal of variability in their memory and their alertness. If you remember going back to the neurotransmitters, when I first introduced them and talked about what the dysregulation of neurotransmitters can mean to us, it was acetylcholine and having low acetylcholine that was related with Alzheimer's. Well, low acetylcholine means I'm necessarily going to be less alert and have less attention, and it is very much influencing the hippocampus. We see smaller hippocampi in people with Alzheimer's. It's also related to memory problems, and again, correlational, but that's what we see. As we start out really not laying down new memories very well, we're going to see anterior grade amnesia more so than the retrograde amnesia of when we start to see that somebody has symptoms of Alzheimer's. We're going to see that they're having a real hard time laying down new memories. And then it's going to have that kind of graded appearance that we saw in that slide with the graded appearance where the Australian talked about his memory loss. But that graded kind of retrograde amnesia is going to move backwards in time. So a lot of people get Alzheimer's later in life, and we don't completely see that. I do have the early onset Alzheimer's in my family, and so I've seen several members of my extended family have gone from, you can tell they don't really have the memory and alertness. They have some confusion sometimes about where they are. They have memory loss, but as they have this for longer and longer, they start to lose more and more of those older memories. And in fact, my grandmother and my aunt lived to the point of not remembering how to eat, how to swallow, asking what am I doing, what's in my mouth, how to go to the bathroom by themselves. They can lose a great deal of everything, but it really starts out with that attention, alertness, and not laying down new memories, confusion, and it's variable. It's really variable of how often they're also sometimes lucid. So we see this memory loss, we see depression, restlessness. They sometimes have hallucinations and delusions. Of course, they're having sleeplessness, which can be very confounded with a lot of those things, and a loss of appetite. Your author talks about several theories, hypotheses of what's going on with Alzheimer's disease. Why do we see it? When are we more likely to see it? And what's happening in the brain? I'm going to start with this. Why do we see it? Why do we think it's occurring? And who's more likely to get it? So chromosome 21 is implicated in Down syndrome, which is one of the reasons they started looking to chromosome 21 and this particular those particular genetics as potentially being linked to early onset Alzheimer's, as people who have Down syndrome, if they live to be middle-aged or have in middle adulthood, then they are very likely to have early onset Alzheimer's. So Alzheimer's affects 50% of the people over 85 years old and 5% of the people 65 to 74. And as we have this aging population, we're going to see more and more Alzheimer's. But about half the patients with late Alzheimer's, late onset, have no known relative with the disease. And we're not sure completely about the genetics of what's going on there, but it does not appear to be very genetically influenced. It looks like there are lots of epigenetic effects. I mean, it's genetic, but there's a lot of influences of environment. And then I know I've seen one study looking at the APOA gene in people in Africa and people in African Americans in Chicago, and they all had the APOA gene, and their diets, how much sugar and saturated fats they were eating was very important for how likely they were to have Alzheimer's. But early onset Alzheimer's does seem to be influenced by genes, and it's much more rare. And what early onset Alzheimer's refers to is people who we see showing symptoms before the age of 60. One hypothesis of what's happening in the brain is that we tend to see higher amounts of amyloid beta, although that's not a really perfect correlation, where some people with early onset Alzheimer's have not as much amyloid beta, and some people with high amyloid beta don't have Alzheimer's. But what appears to happen is the amyloid beta cluster into plaques, and they cause damage. It causes damage to dendrites to axons, and so we're not getting synaptic input, and we're losing synaptic plasticity. And this causes regions of the brain to basically waste away. So areas of the cerebral cortex, the hippocampus, and other areas. And you can see over to the right the degeneration. So in A, that's a quote normal person's neuron, cortical neuron, and in B, we see neurons of someone with Alzheimer's, where we are losing a great deal of the dendrites, the axon, and you can see the very end one has lost pretty much all aspects of any ability to communicate with other neurons. And what you see to the left, the A and B. So A is an example of a brain of someone who had Alzheimer's, and B is a quote normal brain. And so you can see that the folds are much deeper, and so the sulci are much deeper because the gyri have lost just neurons. Another hypothesis of what's going on with in the brain in people with Alzheimer's disease is that it's the tau proteins that are not binding to their usual targets, and so spreading into cell bodies and to dendrites. And this is normally to carry information down the axon, and these kind of little almost trains getting the microtubules down to the axon. And so this causes these tangles. And tau protein, it does look like it's high levels of amyloid beta that are causing phosphate groups to attach to the tau proteins, which is causing these tangles, and so this neuronal damage. There is no known drug that is effective for treating Alzheimer's disease. I have been talking in my psychology of music class with the students in there about some of the music therapies that are now available and how much they might be helping people with Alzheimer's. And I'm sure we're going to come up with more and more possible therapies that might help. As far as pharmacological or neurological treatment, one common treatment involves enhancing acetylcholine activity, thus increasing arousal. So there is this relationship between low acetylcholine and having Alzheimer's. And there's also the smaller hippocampi, which is related to low acetylcholine. I have had one friend, she did not have Alzheimer's, but she did have, so she was in a car wreck where she had some brain damage and she was unable to move. So she had some hip damage. And she also was addicted to smoking, and she got lung cancer soon after this car wreck. And so she was no longer able to move, and she was no longer able to smoke her cigarettes, and they did prescribe to her choline, the amino acid that is a precursor to acetylcholine. And so you can find this in farm fresh eggs. And so one thing I do, because this runs in my family, is I have the farm fresh eggs and I add turmeric, which is the next piece of this. The curcumin, an Indian spice, has also been shown to inhibit amyloid beta deposits as well as inhibiting the phosphate attachment to those tau proteins. So I actually use the eggs, curcumin, and black pepper. Curcumin and black pepper together are supposed to be antioxidants as well, just for cancer. So I figure I'm trying to, be as healthy as I can be. But that they have seen in animal research has been pretty promising. But the human research for curcumin or turmeric, that's really just in the beginning stages.